of the most important questions that I ask when somebody calls about a possible stroke misdiagnosis case is, when was the last time that person seemed normal to you? Who saw them? How are they acting? Did somebody witness them as normal before the stroke? Because one of the criteria we have to look at in a stroke misdiagnosis case is not only did the doctors miss the stroke when the person came to the hospital, but did that person come to the hospital within the window of treatment? Because for strokes, you only have a certain amount of time to treat it before the damage becomes irreversible and catastrophe happens.
A stroke misdiagnosis case is different from most of our other cases in the sense that, one, so many different people are impacted by it. We have cases with people as young as 19 years old who have suffered a stroke that wasn't properly diagnosed, up to people in their 80s. And the other thing about stroke misdiagnosis cases is that right now we are in an evolution of the ability of medical providers, if they timely diagnose and recognize a stroke, to actually be able to treat it and make people who otherwise would have suffered catastrophic injury to go on and live healthy and productive lives with good treatment.
There are two types of strokes: a hemorrhagic stroke and an ischemic stroke. Hemorrhagic stroke is bleeding in the brain, and ischemic stroke is a blood clot that's blocking one of the veins or arteries in your brain and cutting off blood flow. Now, there are two types of treatment. The first type is called TPA, which is basically a clot-busting drug. Basically thins your blood out to help the clot move on and get out of your brain. It's fairly effective, but the more effective treatment is something called a thrombectomy. And a thrombectomy is a surgery that is done by an interventional neuroradiologist, where they go in with a tiny scope and a camera up a vein with some tools on the end of it, and they go up your leg all the way up to your brain. They find that clot and they pull it out. And all of that has to happen within a fairly short amount of time in order for it to be effective. Otherwise, your brain has gone too long without blood flow and oxygen. The damage is irreversible. The brain cells are dead.
There are different types of stroke centers in our communities, and it's one of the things as a lawyer that frustrates me, because we all see all of this advertising. We're a stroke center, we're a stroke center. What they don't tell you is that there are these different levels of stroke center, whether they are a primary stroke center or a comprehensive stroke center. And what's the difference, that you ask? Well, in a primary stroke center, they can only give the TPA. They can't do the thrombectomy, which is the mechanical removal of the clot. So in order for that to be done, if you're outside the window for the TPA to be given, then the patient has to be transferred to another hospital. That can take an hour, hour and a half, or even longer in certain circumstances. And time is brain. So that delay of being taken to a hospital that you thought was appropriate to treat a stroke but really wasn't the best place can make all the difference in the world.
Unfortunately, stroke misdiagnosis is incredibly common. Many of the phone calls we get about stroke misdiagnosis happen because the doctors and nurses weren't properly trained. They don't know how to identify signs and symptoms of a stroke. They think that something different is going on, or they don't know what's going on, but they don't really take the time to look into that patient. They put them in a room, they close the door, and they just leave them there for hours. And with strokes, the longer you go without treatment, the more severe your symptoms get. So a lot of times, someone who's coming in with mild stroke symptoms, and those symptoms are not identified as a stroke, stroke alert isn't called, they start to deteriorate hour by hour, and their stroke symptoms become more obvious. And then they finally identify the stroke, but by then, it's too late to do anything.
The things that we look for in our cases is not just did somebody do something wrong, but what difference did the failure to do the right thing make? How did that change our client's life? Sometimes we'll look at it and we'll say, yeah, they didn't do the right thing, but the outcome wouldn't have changed one way or the other. That's not a case. Most of the time in these missed stroke cases, however, we know that timely treatment, timely recognition of the stroke makes a huge difference. It's the difference between somebody having paralysis and brain injury and the inability to communicate and having to depend on other people for all of their care needs, to being independent, living on their own, able to make decisions for themselves. It's really that stark, and of course, it can often be the difference between life and death.
If you believe that you or a family member were the victim of a stroke misdiagnosis, you should reach out to an attorney as soon as possible. There are a lot of things that need to be evaluated, and there's only a limited amount of time to do that in. So the sooner you reach out to an attorney and get that ball rolling and get that evaluation started, the better off your case will be. You can gather the records yourself or ask an attorney to gather the medical records for you so that they can send them off to an expert who will look at everything and determine whether or not the stroke should have been caught, whether or not it was missed, and whether or not earlier treatment would have prevented the catastrophic outcome that was suffered.